going to be yes. Since it's a going concern, the healthcare system in the country will not be at a standstill. The new things that are coming up. What are the new innovations the PS Kenya is into currently that we can talk about?
Excellent. Right now, our innovations are in the space of ensuring that the communities, we want communities to be fully empowered. You'll realize in this country, there's no entity that is strongly bringing one-on-one grassroots organizations together. So as PS Kenya, we recently launched the Inua Grassroots Network that brings together grassroots organizations. These are small. You realize there are many bits and pieces of passionate people who want to do something, who want to create an impact in this country, but they don't know how. They're wondering, how do I go about this? How do I change my community? So that's where we come in as well, because we come in to empower these community-based organizations. We aggregate, we bring them together so that jointly they can share ideas, come up with best practices and see how best they can be able to work towards helping their communities. We also have a big chunk of donors who want to empower these grassroots organizations, but they don't know where to channel their money through or how to channel it through. Kenya unfortunately is known for a lot of corruption. And these CBOs might not have the systems and structures to be able to absorb lots of resources. So that's where we come in, where we get resources from donors, and we use these resources towards building the capacity of community-based organizations. For example, just to make that idea land, is that we ensure that they have a proper governance structure, they have a board, they have a proper bank account. Some of them operate with, from their phones on M-Pesa. That's where the account for the community-based organization is. So we ensure they're fully registered by the local authorities, that they have proper systems and processes within their organizations, that they have proper policies, if it's finance policies, supply chain policies, human resources for health policies, how they hire and recruit their staff. So we help them set up that structure and prepare them as an organization to get resources from different donors. So that's one of the innovations that we are currently pushing through. We have an active membership of about 30 community-based organizations that are grassroots, the really small ones, not the bigger entities that you may think about, the ones that we vet them and ensure that the work that they're doing at community is actually verified and impactful at community level. So then we support them in building their systems as well. Then we work in the private sector. We have a Tunza social franchise that brings together 400 private health facilities. And within this Tunza social franchise, what we promise is high quality and affordable services at the facility the Tunza facility that is closest to you. So we have a new system. We realize that these smaller facilities may not have a proper enterprise resource management system. So what we have done is that we have developed a enterprise resource management system that we call SaraMed. And this SaraMed system, we've deployed it into various clinics as well to ensure that this entrepreneur who is working in their clinic is able to track all the resources or all the money that is coming in to his own clinic, all the patients who are coming in, that data is stored. And once there's a repeat client, they are able to retrieve that data very easily. We link the reception to the clinician, the person who will be seeing the patient. And also once the clinician sees the patients, they refer them to the pharmacy or to the lab. So we've linked the entire system together to ensure that this clinic, the owner of the clinic, is able to really track resources and know exactly what is going on in his own facility. It's also linked to the payroll of the facility as well, to ensure that this clinic is able to easily balance and know what resources are there. Are they making any profits? Are they making any losses? Is there a lot of pilferage? And we ensure that the systems or the solutions we provide are affordable and easily accessible. Our key point is affordability, because we are looking at empowering more people. We are a not-for-profit. We are not in this space to make any money. We are here. Our profit is the social impact. That's what we are chasing every day. And what helps us wake up every morning is to know that Wanjiko will be empowered to make a better choice in their healthcare. Wanjiko, if she needs contraceptives, she'll get it. If Wanjiko has a child, she'll take her child to be immunized at the closest health facility. Her child will be exclusively breastfed up to 6 months. Her child will get the proper feeding up to 2 years. And this child will go to school and thrive. That is our joy. And once the child grows, we also want to see this child participating even in social activities in school. If there are any things within the community, we want this child to be in that space and to be fully empowered. And we do not forget the other person. In addition to Wanjiko, there's somebody else. Yes, the man is also important to us. So our Wanjiko in the company, we call Wanjiko Sarah, and the gentleman is Sam as well. So we look at the community in its entirety.
One of the Sarah made, isn't it?
Exactly.
Fantastic. In 15 seconds, therefore, as we step out of the studio, somebody wants to donate to you directly, what can they do?
Excellent. Anyone who wants to reach to PS Kenya, we are very active on social media. Do reach out to us. Our website is www.pskenya.org. We are also on Twitter. Our handle is at PS Kenya. We are on LinkedIn at PS Kenya. We are also on Instagram at PS Kenya, and on TikTok, to the people and the population that we are all working towards reaching. So feel free, reach out to us on at PS Kenya. If you want to send us an email, do send us an email at info@pskenya.org. And we look forward to responding to you and engaging further.
Pretty much. Oof. I mean, can you have a better conversation about healthcare in the country? I doubt. Now, you do know exactly what that is. We were speaking to the acting CEO of PS Kenya. That's Dr. MARGARET. She's gone through a lot that PS Kenya is into. Take her back to the time that she joined us right here on Look Up TV across all your social media platforms.